Welcome to a webinar on Medicare and Work. There are 4 learning objectives for this webinar. First, to be able to identify key points about the Medicare program, about Medicare savings programs that reduce or eliminate out-of-pocket costs for Medicare for some people, and Medicare Part D low-income subsidies, which greatly reduce the cost for Medicare Part D plans. Second, to list Medicare work incentives that enable people to keep Medicare even if they've worked their way off Social Security disability benefits. Third, to provide accurate information and dispel myths about Medicare and work. And fourth, to explain your role as a benefit navigator or benefit planner in addressing myths and concerns about Medicare and work when you work with individuals. Starting with Medicare basics. Medicare is a health insurance program operated by the federal government that's funded by payroll taxes through the Federal Insurance Contributions Act, also known as FICA, which is for wage employees, and SECA, the Self-Employment Contributions Act, which is the way that self-employed people pay into Medicare taxes. And it's also funded through monthly premiums that people who receive Medicare pay. There are 4 parts. They're conveniently labeled by letter, A, B, C, and D. This training will cover only parts A, B, and D. Medicare Part C, also known as Medicare Advantage plans, are optional ways that people can choose to receive most or all of their Medicare services through a private company, either a health maintenance organization, HMO, or a preferred provider organization, PPO. But these are entirely optional, and you can get more information about Medicare Part C plans at DB101, mo.db101.org. Now, there's a state resource that's very helpful in addressing Medicare questions and helping people choose plans, particularly Medicare Part D plans. It's called Community Leaders Assisting the Insured of Missouri, or CLAIM. Their website is missouriclaim.org, and their phone number is 1-800-390-3330. And I highly recommend them anytime people have questions about which Medicare plans they might want to enroll in, or more detailed questions about Medicare. They know a lot more than we'll be covering during this session. So who's eligible for Medicare? Most people who get Medicare are eligible based on age. If you're 65 or older, you can get Medicare based on age. Some people who have end-stage renal disease, kidney failure, can get Medicare based on kidney disease. Most people that we work with are receiving Medicare because they're entitled to Title II benefits, Social Security Disability Insurance, SSDI, that they get on their own earnings record, or CDB, a Childhood Disability Benefit, also known as Disabled Adult Child or DAC benefit, that they get on a parent's earnings record, or Disabled Widows and Widowers Benefits, DWB, that they receive on the earnings record of a deceased spouse. Now, if a person gets Medicare through Title II benefits, there's a 24-month waiting period. They have to be entitled to the Title II benefit for 24 consecutive months, and then the 25th month, they get Medicare. However, there's an exception for people with amyotrophic lateral sclerosis, ALS, also known as Lou Gehrig's disease. Those individuals just have to be entitled to Title II benefits, they have no 24-month waiting period. So they can get Medicare as soon as they become entitled to the Title II benefit. Now, people who get Title II benefits and wait the 24-month waiting period, or who have ALS and don't have a waiting period, are automatically enrolled in Medicare. So let's go into some details about the three parts to Medicare that we're going to be discussing: Part A, Part B, and Part D. Part A is hospital insurance, and that covers mostly hospital services. It can provide a limited period of coverage for skilled nursing facilities and some home health and hospice care. People are automatically enrolled in it when they become eligible, particularly after that 24-month waiting period that most people get if they're receiving a Title II benefit. There is a monthly premium for Medicare Part A, but anybody who's receiving a Title II cash benefit does not have to pay the Part A premium. And we'll be talking about who does have to pay the Part A premium later in this session. There are deductibles and co-insurance for people who get Part A. So they generally don't have to pay a monthly premium to get Part A, but if they go into the hospital or nursing facility or getting home health, then there are deductibles and co-insurance. Deductible is an amount that you have to pay out of pocket before Medicare starts paying anything. And then co-insurance would be sort of a match where Medicare pays a percentage and the individual has to pay the rest. Medicare Part B is for doctors and outpatient services. There is a standard monthly premium for Part B. In 2020, it's $144.60 a month. It may be a little lower for some people who've been receiving Medicare longer, and it can be higher for people with higher incomes. Single people with over $87,000 of annual income and married couples with over $174,000 of annual income may pay higher than the basic $144.60 a month. Now, for people who are receiving a Title II benefit, usually the monthly Medicare Part B premium will be deducted from the Title II benefit before they receive their payment. But there are some people who qualify for financial help that pays the Medicare Part B premium for them. And we'll be going into details about Medicare savings programs that do that and a few other programs as well in a little bit. Medicare Part B also has out-of-pocket expenses in the form of an annual deductible and co-insurance. Part B is optional. If a person is automatically enrolled in Medicare Part A, which is mandatory, they will also be enrolled automatically in Medicare Part B. But if they select not to enroll in Part B and they take the initiative to decline it, then they won't be enrolled. So enrollment in Part B is automatic unless the person declines it, but they do have the option to decline it. And in that sense, it's an optional benefit. Now, there's a downside, however. If a person declines to enroll in Part B when they become eligible, and then they decide to enroll later, they may have to pay a higher monthly premium with certain exceptions. And that higher premium would last for as long as they're eligible for Medicare. So generally, it's a good idea for someone who receives Medicare Part A, becomes eligible for Part A, to accept Part B as well. Although there are some exceptions if someone is receiving insurance maybe through an employer, through a spouse, through a parent, that's comparable to Medicare Part B, they may be able to decline Part B and just keep the other medical insurance they have for a period of time. And then they can be exempt from any premium penalty, any higher premiums they might otherwise have to pay if they enroll in Part B later. Finally, Medicare Part D is prescription drug coverage. This is the newest part to Medicare, although it's not very new anymore. It's over 15 years old. But Medicare Part D prescription drug plans are a bit different from Part A and Part B in that they are administered by private companies. And there are usually dozens of different private plans that an individual can choose from. This is one time when calling claim, the service we talked about earlier, can be useful when someone is puzzled about which Part D plan they should choose if they've got dozens to choose from. But they are operated by private companies, and a person enrolls directly with the private company that provides that plan that they've chosen. And the out-of-pocket expenses they have to pay for can vary greatly from one private plan to the next. So we're just going to do a quick matching game here for parts A, B, and D. And what you want to do is look at Part A, Part B, and Part D and match each one with the services that it covers. And the choices are doctor and outpatient services, prescriptions, and hospital services. So you can take a moment to match Part A, B, and D with those three options that they cover. And the correct answers are Part A covers hospital services, Part B covers doctor and outpatient services, and Part D covers prescription drugs. Now, as we noted on the last several slides, each part to Medicare, Part A, B, and D that we're covering, does have out-of-pocket costs associated with it. But fortunately, there are three programs known as Medicare Savings Programs that can help with Part A and Part B out-of-pocket expenses. And a little later, we'll be talking about a program that can cover Part D out-of-pocket expenses. So the three Medicare savings programs that can help with Part A and Part B expenses are known as Qualified Medicare Beneficiary, or QIMB for short, Specified Low-Income Medicare Beneficiary, or SLIMB, and Qualifying Individual, also known as QI1. Each of them covers some Medicare out-of-pocket expenses, but they differ in which expenses they cover and income eligibility. So we'll start with Qualified Medicare Beneficiary, or QIMB. This one provides the most help. This pays for Part A and Part B premiums, deductibles, and coinsurance. So it covers just about all of the Part A and Part B out-of-pocket expenses. The income limit is the lowest of any of the three Medicare savings programs. A person's countable income has to be under 100% of the federal poverty level. In 2020, for an unmarried person, that's under $1,064 a month, and for a married couple, this year it's under $1,437 a month. Now, here's a quick note that there are some other ways that some Medicare out-of-pocket expenses can be covered in addition to the three Medicare savings programs. One is through Medicaid, which is also known as Mo Health Net in Missouri. If a person is receiving both Medicare and Medicaid, or Mo Health Net, then Mo Health Net will pay the Part B deductibles and co-insurance, but only if the service that Medicare is covering is delivered by a provider who participates in Mo Health Net. Another note that there are several other programs that eliminate the Part B premiums, where the state of Missouri actually pays the Part B premium for a person. So if an individual is receiving SSI benefits, or supplemental nursing care payments, or supplemental aid to the blind, then those programs will qualify them for assistance from the state, and the state will pay their Part B premium. Also eligible for the state to pay Part B premiums are people receiving supplemental payments that are based on them receiving supplements if they had been receiving benefits before the SSI program began, before 1974, but there are only 20-some people left in the state who are receiving those payments, so you'll probably rarely, if ever, encounter them. So moving on to the next Medicare savings program, Specified Low-Income Medicare Beneficiary, or SLIMB. This one pays only the Part B premium and none of the Part A expenses, and not the Part B deductibles or co-insurance. So it covers less of the expenses, but it does have a higher countable income limit. Instead of 100% of federal poverty, which the Quimby program uses, SLIMB uses an income limit of 120% of the federal poverty level. And for an unmarried individual, that's under $1,276 a month in 2020. And for a married couple, it's under $1,724 a month. And finally, the third program is the Qualifying Individual, or QI1 program. Like SLIMB, this one covers only, pays only the Part B premium, but it does have a higher countable income limit than SLIMB. It goes up to 135% of the federal poverty level, which is $1,436 a month for an unmarried individual in 2020, and $1,940 a month for a married couple. So you might wonder if SLIMB and QI1 cover the same thing, they just pay the Part B premium, but they have different income limits, then what's the difference between the two? Well, there are a couple of key differences. One is that a person who's enrolled in Medicaid, also known as Mo Health Net, cannot be eligible for QI1. So a person would have to choose between the two, either take Mo Health Net or Medicaid or QI1, but you can't have both at the same time. Secondly, there is a limited budget for the QI1 program. And if the funds run out because enough people have enrolled in it, then new people cannot enroll in the same year. In contrast to SLIMB, which does not have a limited budget. So anybody who's eligible can enroll at any point throughout the year. So each of the three Medicare savings programs has a countable income limit and a countable resource limit. To figure out countable income, the programs use the SSI rules. They use the various SSI exclusions. to determine countable income. And each of the three Medicare savings programs has a resource limit, and each of the three uses the same resource limit. For an individual, an unmarried individual, the resource limit is $7,860 in 2020. For a married couple, it's $11,800. So significantly higher than the SSI resource limits. And again, this limit on countable resources is the same for Quimby, SLIMBY, and QI1. So now just a quick quiz for you. You want to check all of the following statements that apply to each Medicare savings program. So for Quimby, the options are it pays Part A and Part B premiums, deductibles, and coinsurance, or pays only the Part B premium. Countable income limit is 100% of federal poverty level, 120% of federal poverty level, or 135% of federal poverty level. You're not eligible if getting Mo Health Net, and limited budget if funds run out, new people can't enroll. So what you want to do is check each of those statements that's true for Quimby. So pause for a few seconds, make your choices, and then we'll move on to the next slide. And the correct answers are Quimby pays the Part A and Part B premiums, deductibles, and coinsurance, and the countable income limit is 100% of the federal poverty level. Moving on to SLIMBY, you have exactly the same choices of statements, and you want to choose each one that applies to SLIMBY. And the correct answers are SLIMBY pays only the Part B premium, and the countable income limit is 120% of the federal poverty level. And finally, the qualifying individual or QI1 program. Once again, you have the same choices. And a hint, there are more than two answers for this one. And the correct answers are QI1 pays only the Part B premium, just like SLIMBY. Countable income limit is 135% of the federal poverty level, the highest of the three programs. You're not eligible for QI1 if you're getting Mo Health Net, also known as Medicaid, and there's a limited budget for QI1, so if funds run out, new people can't enroll during the year. So let's go through a quick Medicare savings program example of a person who's receiving SSDI and then gets some earnings. So this is Latasha, who gets SSDI of $1,200 a month. She's enrolled in Medicare and SLIMBY, but then she gets a job offer to earn $900 a month gross wages. So what we want to do is figure out her countable income for Medicare savings program purposes. And remember, you're using the same rules as the SSI program uses. So we start with her unearned income, her $1,200 of SSDI. We subtract the $20 general exclusion, and that leaves $1,180 of countable unearned income. Then we take the $900 in earned income, the gross wages that she starts earning. We subtract the $65 earned income exclusion, take the difference of $835 divided by 2, and that leaves $417.50 of countable earned income. Finally, we add her countable unearned income and her countable earned income together and get total countable income of $1,597.50. Now, the problem is $1,597.50 is greater than the countable income limit for the Medicare Savings Program that has the highest countable income limit, QI1. QI1 countable income limit for an unmarried individual like Latasha is only $1,436. So if Latasha takes this job, her countable income would not only be above the limit for SLIMB, which is the benefit she started out with, but would even be too high for QI1. As a result, she won't be getting help paying for Part A or Part B expenses, and she'll have to start paying her Part B premium out of pocket. Let's do another example. This one is Marco, who gets $900 a month of SSDI. So his income is lower than Latasha's, and he qualifies for QIMBY. And of course, he's also receiving Medicare. He starts a job getting gross wages of $700 a month. And the first thing you want to do is figure out what his total countable income would be. Again, using the SSI rules. You can pause the webinar here to come up with your answer and then return. Okay, and the correct answer is he's got $880 of countable unearned income, $317.50 of countable earned income, for total countable income of $1,197.50. So this slide shows the countable income limits for an unmarried person like Marco for QIMBY, SLIMBY, and QI1. Marco's countable income is $1,197.50. And you want to identify which of the three Medicare savings programs he should qualify for based on his countable income. So again, the QIMBY countable income limit, $1,064 a month. SLIMBY is $1,276 a month. QI1 is $1,436 a month. So which one would Marco be eligible for with countable income of $1,197.50 a month? And the correct answer is SLIMBY, because his countable income is too high for QIMBY. It's over $1,064, but it's below $1,276, the limit for SLIMBY. So we're going to move on to Medicare Part D now, which is prescription drug coverage. Like Part B, enrollment in Part D is optional, but unlike Part B, a person will not be automatically enrolled in Part D generally. They have to take the initiative to enroll in it through a private plan. But there's an exception. If the person is enrolled in Medicare and they receive either Mo Health Net, Medicaid, or a Medicare savings program, then they will be automatically enrolled in a Medicare Part D plan. And they won't be choosing that plan. However, once they've been automatically enrolled in a Part D plan, if they would prefer to change the plan and enroll in a different plan, they can go ahead and do that. But they do need to enroll directly with the private company that administers the Part D plan that they choose. So as I mentioned earlier, the out-of-pocket expenses vary depending on which private plan the person chooses. Now they can include a monthly premium and or an annual deductible. The annual deductible can't be higher than $435. So in other words, the person can't be required to pay more than $435 when their plan year begins before the Part D plan starts providing coverage. And the deductible could be less. So there are two phases for prescription copays after the person has met their deductible. Initially, their coinsurance will be about 25%. So the Part D plan, after the deductible has been met, will pay generally 75% of drug costs, and the individual will pay the other 25%. And that will continue until out-of-pocket costs have reached $6,350 total for the year. Now, after that, copayments will decrease through a period of what's known as catastrophic coverage. If the person pays over $6,350 in a year, then the amount they'll have to pay for drugs after that goes down significantly. After that, their copays will be the greater of 5% of the actual cost of the drugs, or $8.95 per drug for brand name drugs. And for generics, they'll pay the higher of 5%, or $3.60 per drug. And that will be their catastrophic coverage for the remainder of the calendar year. Now, some of you may have heard about something known as the Medicare Part D donut hole, which was a coverage gap that existed before 2020. It was a period during the middle of the coverage year when a person got no help paying for their drug costs and had to pay all of them out of pocket without any help from their Part D plan. However, the Affordable Care Act gradually phased out that donut hole from 2014 through 2019. And as of 2020, there is no longer a coverage gap. The donut hole has been filled. Now, people who get Medicare Part D may qualify for a financial assistance program to help them pay the Part D out-of-pocket costs. And there are two subsidy programs. They're both known as low-income subsidy, also known as extra help. One of them provides a full low-income subsidy, so it provides the most assistance with out-of-pocket costs. And the other we'll cover next is the partial low-income subsidy, which, as you would imagine, provides less intensive financial assistance. So starting with the full low-income subsidy, a person is automatically eligible, it's also known as being deemed eligible, for the full low-income subsidy if they're enrolled in SSI or Mo Health Net, Medicaid, or a Medicare savings program. They'll be automatically enrolled. They don't even need to apply. Now, if a person is not automatically eligible, they're not receiving SSI, Mo Health Net, or a Medicare savings program, then they won't be automatically enrolled, but they can apply through Social Security for a full low-income subsidy. To qualify, their countable income has to be under 135% of the federal poverty level, which is the same countable income limit that we looked at for the QI1 program. So it's $1,436 a month for an unmarried person and $1,940 a month for a married couple in 2020. Their countable resources have to be below a limit, and that limit is either $7,860 or under $13,110 for an individual, or for a married couple under $11,800 or under $26,160 in 2020. So you're going to be wondering, well, when would they use one of those countable resource limits and when would they use the other? Because there's a big difference between the lower and the higher amount of the countable resource limits. We'll get to that in a moment. And countable income is calculated using the SSI exclusions, the same way the countable income for the Medicare savings programs is computed. So a full low-income subsidy pays for most, if not all, of the monthly premium for Medicare Part D. It pays the deductible, and it requires the person to pay prescription copays that are no more than $3.60 to $8.95 per prescription. Now, a person is eligible for the partial low-income subsidy, not as much extra help, if their countable income is above 135% of the federal poverty level, but no higher than 150% of the federal poverty level, and their countable resources are below $13,110 for an individual or $26,160 for a married couple. So here's where that higher countable resource limit comes in. The partial low-income subsidy pays a percentage of the monthly premium, but not the entire amount. It pays $89 of the deductible. The deductible, again, could be as high as $435 a year. And coinsurance is 15% until the catastrophic level is reached, and then coinsurance is 5%. So coinsurance that the individual has to pay with the partial low-income subsidy is greater than they would have to pay with the full low-income subsidy. So the partial low-income subsidy provides some help, but clearly not as much as the full low-income subsidy. So to apply for a partial low-income subsidy or for a full low-income subsidy if the person's not automatically deemed eligible, they can apply at Social Security, and they can use the link on this slide, secure.ssa.gov/I, lowercase I, 1020/start to get more information. Now, if a person's eligibility changes sometime during the year, let's say they go to work and their countable income increases high enough that they're no longer eligible for a low-income subsidy, then the reduction from a full low-income subsidy to a partial low-income subsidy, or the loss of the low-income subsidy completely, will not take effect until, at the earliest, January 1st of the following calendar year. So a person gets some time to adjust to the idea that they're going to lose that low-income subsidy or have it reduced before it actually kicks in, because it doesn't take effect until the following calendar year at a minimum. So let's go through a low-income subsidy example. This is Portia, again, who's getting SSDI of $1,250 a month. She gets Medicare and SLIMB. She receives a job offer with earnings of $1,140 a month gross wages. So the first thing you want to do is figure out what her countable income will be for the Part D low-income subsidy. And you can pause the webinar, do your calculation, and then return. So again, we use the SSI countable income rules, and we come up with $1,230 of countable unearned income, $537.50 a month of countable earned income, for total countable income of $1,767.50 a month. So the countable income limits for an unmarried person for a full low-income subsidy would be $1,436 a month. For a partial low-income subsidy, it's $1,595 a month. So which low-income subsidy would Portia be eligible for with countable income of $1,767.50 a month? Clearly, the answer is she would not be eligible for either a full or partial low-income subsidy. Her countable income would be too high. But the next question is there another way Portia could qualify for a low-income subsidy? And the answer is yes, if she becomes eligible for MoHealthNet through the Ticket to Work Health Assurance Program, TWHA, because she appears likely eligible for it. And if she enrolls in MoHealthNet through TWHA, remember, a person who's enrolled in MoHealthNet is automatically or deemed eligible for a full low-income subsidy. So if she enrolls in MoHealthNet, she not only gets Medicaid coverage, but she also gets a full low-income subsidy for Part D. So there are several common myths about Medicare and work that you should be on the lookout for. One of them is, if I go to work, I'll lose my Medicare. This is absolutely not true. We'll be talking about Medicare work incentives shortly. And in fact, not only can a person keep Medicare when they work, even if they work their way off Social Security disability, but if they're working, they might even be able to get additional health coverage in the form of MoHealthNet through the TWHA program if they're eligible. So they can not only keep their Medicare, but they might also be eligible for MoHealthNet. Second myth you'll run into often is, if my SSDI stops due to work, I'll lose my Medicare. This one is kind of logical. You would think, since you started getting SSDI and then received Medicare after a 2-year waiting period generally, and the Medicare eligibility was based on SSDI eligibility, it's kind of logical that if your SSDI stops, your Medicare might stop as well. But it's not true. Even if a person works their way off SSDI through SGA level earnings, they can still keep their Medicare. And that's where the Medicare work incentives we'll talk about momentarily come in. And once again, if a person qualifies for the Ticket to Work health assurance program, they can not only keep their Medicare, but get or keep Mo Health Net as well when they're working. And the third myth that you'll run into frequently is, I can't have both Medicare and health insurance through my employer at the same time. And in fact, you can have both at the same time. So a person can either enroll in both if they choose, have both Medicare and employer-sponsored health insurance simultaneously, or they could choose one or the other. Although they need to check with their employer to see if the employer requires them to keep Medicare if they're eligible for it. They can also enroll in employer-sponsored health insurance if they choose. So let's move on to the Medicare work incentives. And these are all about keeping Medicare if a person's Social Security disability benefit stops due to work. Now, first off, if a person's getting Social Security disability, one of the Title II benefits, the SSDI, CDB, or DWB, their Medicare will certainly continue as long as they receive the cash benefit. But if their cash benefit stops due to work, then there are two Medicare work incentives that become available that will let them keep Medicare, even though the Social Security disability cash benefit has stopped. The first one is called the Extended Period of Medicare Coverage, or EPMC for short. And the second is called Premium Health Insurance, or Premium HI, for the working disabled. So both of them enable people to keep Medicare if their Title II disability benefits have stopped because they're doing SGA level earnings for a long enough period. So these two work incentives function consecutively. The Extended Period of Medicare Coverage, the EPMC, kicks in first. And then when that ends, then the person can use Premium HI for the working disabled. And Premium HI for the working disabled can continue until the person turns 65. When they turn 65, they don't lose eligibility for Medicare, they keep it. But they switch from receiving Medicare based on disability to receiving Medicare based on age. And then they would no longer need Premium HI for the working disabled. They'd be eligible for Medicare because they were 65 or older. So some more details about the Extended Period of Medicare Coverage, or EPMC. If the person works their way off their Title II disability benefit, the EPMC says that they'll remain eligible for Medicare without having to pay anything extra for it for at least 7 years and 9 months after their trial work period has ended, as long as they're still medically disabled. So note here that it says that the Medicare will continue for at least 93 months, or 7 years and 9 months after the trial work period. But the EPMC can be longer than 93 months in some cases. It depends on when the cessation month occurred. The cessation month, as a reminder, is the first month of SGA after the trial work period has ended. So if a person does SGA every month after the trial work period, then their extended period of Medicare coverage will be the minimum 93 months. But if the person didn't do SGA in every month, there's a different calculation that's going to differ from one person to the next. And it would be necessary to know when the person did SGA in order to figure out the actual length of their EPMC. Now, after the EPMC ends, whenever that is, according to when the person did SGA, after their trial work period, then the premium HI for the working disabled work incentive kicks in. And that one lets a person continue receiving Medicare, but generally there's an additional cost. They have to pay the Medicare Part A premium, which they were not paying up to that point. Now, to be eligible for premium HI for the working disabled, the person's Medicare with free Part A must have ended after they used up their extended period of Medicare coverage. They have to continue to be medically disabled, and they have to not be eligible for Medicare any other way, such as being 65 or older. Now, that additional premium that they usually have to pay, that Part A premium, is quite hefty. If they have fewer than 30 work credits, which would generally be earned with about 7.5 years of work, they'd have to pay $458 a month for that Part A premium. If they have 30 or more work credits, they only pay $252 a month, but it's still a significant amount. And if someone uses premium HI for the working disabled, not only would they often have to pay the Part A premium, although there's an exception we'll get to in a moment, but they'd also have to pay Part B and Part D expenses out of pocket unless they were eligible for financial assistance with those through Medicare Savings Program or a Part D low income subsidy or both. So we're going to go through a few exercises here so you can figure out which Medicare work incentive a person could use in each scenario. The first one is Josefina, whose SSDI stopped because of SGA level work. She's done SGA, worked at the SGA level every month since then. Done SGA every single month. Her trial work period ended 80 months ago. Her disability has not improved. She's still medically disabled. So which Medicare work incentive would she be able to use now? The extended period of Medicare coverage, premium HI for the working disabled, or it's uncertain because you'd need more information. Take a moment, come up with your answer. And the correct answer is the extended period of Medicare coverage. We can tell since she's done SGA every month after her trial work period that her EPMC will be the minimum 93 months. But it's only now been 80 months since her trial work period ended. And she's still medically disabled. So she's still within that 93-month period of the EPMC. And the EPMC, or extended period of Medicare coverage, is the correct answer. Okay, number 2 is Latrell, who receives a disabled adult child, or DAC benefit, also known as CDB, or Childhood Disability Benefit. And that benefit stopped due to SGA. He's doing SGA now, His trial work period ended 95 months ago, and he's still medically disabled. His disability has not improved. So which is the correct answer for Luttrell? EPMC, premium HI for the working disabled, or unsure and need more information to come up with an answer? And the correct answer is unsure, we need more information. We know that Luttrell's trial work period ended 95 months ago, but we don't know about his pattern of SGA after his trial work period. So we're not in a position to figure out precisely when his trial work period ended. It could have been the minimum 93 months after his extended period of Medicare coverage ended. It could be the minimum 93 months after his trial work period ended, but it could be later. So we're not sure if his EPMC would have ended in fewer than 95 months or more than 95 months or exactly 95 months. We'd need more information about his pattern of SGA. And finally, number 3, Gretel's disabled widow's benefit stopped due to SGA. Her trial work period ended exactly 96 months ago. She's earned above the SGA level every month since then, and Social Security told her that her EPMC would last 93 months after her trial work period. So which is the correct answer for Gretel? And that one, as you would expect, is premium HI for the working disabled. She already knows that her EPMC was only 93 months long, but it's been 96 months since her trial work period ended. So her EPMC has ended. That's when the premium HI for the working disabled kicks in. All right, now there's another work incentive that people can use during premium HI for the working disabled. And this one's very helpful because it pays the Part A premium so the individual doesn't have to pay it. In other words, if a person in the premium HI for the working disabled is eligible to keep their Medicare, if they're also eligible for this work incentive, qualified disabled and working individuals, or QDWI for short, then they don't even have to pay the Part A premium. They could keep Medicare without having to pay anything extra for it, without having to pay that extra Part A premium. So to be eligible for QDWI, person's countable income using the SSI rules has to be under 200% of the federal poverty level. That's under $2,127 a month for an unmarried individual in 2020, and for a married couple under $2,874 a month. And countable assets have to be under $4,000 for an individual or under $6,000 for a married couple. Now, there is a catch. A person is not eligible for QDWI if they're enrolled in MoHealthNet, in Medicaid. So they'd have to choose either to enroll in QDWI if they're eligible and have QDWI pay their Part A premium, or to enroll in MoHealthNet or Medicaid, but they can't be enrolled in both at the same time. So there's no time limit on how long you can use QDWI, except once you reach age 65, your Medicare eligibility switches to Medicare based on age rather than disability. And at that point, you would no longer need QDWI. You just have to remain eligible to keep it. And because you must remain disabled, medically disabled, Social Security will continue to do medical continuing disability reviews, or CDRs. Now, here's the nice thing about the QDWI program. Usually, when a person is in premium HI for the working disabled, since they've already worked their way off their cash Title II benefits, usually at this point, their only income will be earnings. Usually won't have other unearned income. Remember, we're using the SSI rules, which count less than half of earned income. So an unmarried individual who has only earned income can actually earn just under $4,339 a month in earned income, which is a little over $52,000 a year, and still meet the countable income limit for QDWI, because a little less than half of their earnings would be countable. So in other words, a person can have pretty significant earnings and still be eligible for QDWI to cover that Part A premium if they need it covered. So finally, what's your role as a benefit navigator or benefit planner in addressing Medicare issues? Well, you want to be able to tell people who receive Title II disability benefits that so long as their Title II benefit continues, their Medicare will also continue. This assumes that they're already receiving Medicare after the 2-year waiting period that applies to most people. You want to let them know that even if their Title II benefit stops due to work, they can still keep their Medicare, and they can keep it indefinitely with the help of the 2 Medicare work incentives we talked about. You want to let them know about the Medicare savings programs and the Medicare Part D low-income subsidy, how they can be eligible, how their eligibility might change if they go to work or change their earnings levels. You want to dispel those myths about Medicare and work. And if you run into issues you're just not sure about, always refer them to a CWIC. So a quick summary then, you now know the basics of Medicare Parts A, B, and D. You know about the Medicare savings programs and about Part D low-income subsidies. You know about Medicare eligibility based on disability. If a person receives Social Security disability benefits and they've been entitled for at least 2 years, or they have ALS, in which case they'd have no waiting period. You know about the 2 Medicare work incentives, the EPMC, followed by the premium HI for the working disabled. And you know about qualified working disabled individuals, or QDWI, which can pay the Part A premium during premium HI for the working disabled if the person is eligible. And thank you very much for completing this webinar.